gather full ground. And today, now one better topic again. Now don't carry con give on. I know say Everly will know they ever disappoint. Week in, week out. Now better topics. Now they carry show. Wonderful. Take learn about the different special needs conditions and how to take support these individuals, these people when get these different conditions and their families. And as it take been normally no be one person in this studio. And I sure say by the time the camera don't the roll, I go shock the person we sit down for guest seat today. And I welcome I beg make a follow the way people wey dey inside house introduce themselves. I am
Na you dey go shock, huh? My people, una good afternoon. Now welcome. Now welcome to our program today. Last week I no dey here. I hope say una not miss me too much, but I miss una.
I do.
I miss face-to-face contact with una, but una do well for say una dey join us every Saturday. They support us like this. I know say una wey dey follow us since una know the person wey dey talk already. But for people wey newly join us, my name na Modupe Afiz Ogun. Na me be CEO founder of Modupe Afiz Ogun Foundation. I be mama of pikin wey get autism. I be registered behavior therapist, and all of us we dey here. We dey meet every Saturday like this to talk about special needs condition where they affect our children, affect our family members, how we fit to support them, how we fit to support family, and why important make government and everybody will not get this condition with the support these people with this condition. Now welcome.
Correct. For the other side, we follow get a person who I thought saying na pillar last week. Where they fight me say ain't no sure which pillar that one be. I beg make Mr. Boniface introduce himself.
All right, my people, now welcome. Now do well to join us again another Saturday. We God don't give us. I shall see una don't carry una pen and una paper.
Abi?
Now still
Alhamdulillah, thank you so much, brother.
welcome. My name now for those way just they join us for today. My name now Oga Boniface.
Oga Boniface.
Mr.
Mr. Spam.
Mr. Sam. Mr. You give everybody.
Let me give them.
I don't go fit use the other any other name.
I'm telling Oga Boniface.
Correct. Ayana, as we dey talk now, in another very strong part of this program show. I beg, make Dr. Bako, make we hear you. I beg.
My people, now well done. Oh. I believe say una don't join us to at least engage in another very interesting discourse. Once more again, my name is Dr. Bako Stephanus Bintum. I'm a neurologist and also the Secretary Enemy Plateau State. Thank you.
Welcome, welcome, and even our listeners. We happy where we say now join us, and even the people we they try join since like that kind 3 p.m. we can they get small technical issues, and I still wait till everything comes up. I want especially appreciate all of us where we. And today we enter sharp. Make we make the most of this small time where they use take dissect, discuss. The topics where we'll get for every weekend. So today, I saw something I don't say I'm on top flyer. Saying communication disorders. Now I want to discuss today. Communication disorders. And before we jump inside, I go on make one appeal. I want beg. Say if you get person where they close to you, or you get person where you know say go fit benefit from this kind of discussion we won't get today, Bako call them.
Yes.
Call and say send them the link. The link where you must use stay join, send them, invite your people, and waiting Oga Boniface talk. Carry jotter, carry pen, follow body, because waiting you won't follow us today, dear where. First things first, I want since Oga Boniface as those of us will be our like listeners through and through, we don't they follow us since day one. And I don't hear say Oga Boniface na speech therapist. And speech follow anything where you talk, the way they take express yourself, say they use words, all of that now in work be that. So today na him go be our na him go dey in charge.
Then carry paper and barrel.
So even we wait there yourself, we go dey follow us small.
Small.
So Oga Boniface, I beg, make our listeners for follow understand this thing well. Wetin be communication disorder and how they take affect people?
All right. I go approach this question. I will dissect them in two ways. There's communication, and we'll talk about disorder. Then we'll bring them together. Okay. I say I go follow this question like this. We'll dissect them in two ways. We'll talk about communication, then we'll talk about disorder.
Yes.
Then we'll join them together. I believe, say, if we do that one like that, it will help us well. You see, communication now one big umbrella term. We cover every aspect or every means of decoding or gathering information and then passing it to somebody. Maybe say they involved as they into the aspect of you being able to pass information to another person. Now it be communication. Pass your own idea. What you they think for mind. What you get for mind. Now, communication, my own aspect now speech and language. Or you get so many aspects or so many ways where people they use they communicate.
Yes.
Communication not just they restricted to the area of speaking. You get people where they use many means to communicate. Communication they happen when what you get in mind, when you sabi pass that same information to the other person. Make the other person understand you well.
Yes.
And it be communication. Anything we go come spoil that particular process where they say you they receive information or you they give information. Now it be communication problems. And for communication problems, you get communication difficulties, they get communication disorder.
Okay.
But disorder now be say you get condition where don't already happen to the person. Where be say in they stop that simple or free flow of information between one person and the other person. And him be disorder. Disorder be condition where be say it don't happen to the person. It go fit be neurological conditions. It go fit be physiological conditions where be say it don't affect the person generally.
Yes.
And as it don't affect the person, it go stop that person's ability to pass that information to the next person. So now him be communication disorder. Now communication disorder any condition whatsoever where be say it go fit affect the process the process of person to pass information, person to hear information, receive or understand waiting person they tell them. And every other means of communication, anything we impede that process, now it be communication disorder.
Kai, Oga Boniface, you don't finish work. As they talk, so the thing they sweet me, but I can't the reason some kind our listeners we don't know say this program na pigeon program. When you don't come they carry us go school, that not be even first degree. We don't enter
second master.
Seriously.
I know my mouth because not be the host. Then I say this madam, give space now. You say you no go host, let who host.
But as you talk, myself, I don't learn from waiting you talk because I like the way you keep the thing for ground, separate them.
Yes.
You first tell us waiting communication be and waiting disorder be, and you mentioned say communication no be only waiting you talk.
Yeah.
But now say anything within your mind, you feel make another person understand them.
That Boniface na teacher.
Seriously, I don't learn no. So as you tell us that one finish, you can't tell us say disorder they different from difficulty. Say something hard you no mean say you get disorder for that thing.
When you mention that difficulty and disorder, okay? Make I hear what your guy want talk.
So I don't learn that one, Jean.
Yeah.
Say disorder na something we don't already dey body. Maybe which kind big names where you say? You be like use physiological. Maybe something worry the body gone.
Bako side.
Then which other one you talk? You mentioned psychological. Say na mind assist. You see.
Any challenge, any difficulty we person face, we be say the difficulty they arise from
Eh,
challenge for
in
body,
body.
or the various articulators will be the
I don't
It's-
understand.
various organs.
When you make you talk,
This man don't lost me.
Various
Oh.
organs wey we dey use to speak
Uh-huh.
affect am.
Yes.
You understand? And him be all those other.
Okay, Boniface, Biko, no cause fight today. This year,
Me, at that fight, me, I go fight am. Oh. I
no, but I like the way you take explain this communication disorder give us, and as we dey go, we go follow talk about the different types of communication disorder. But now I should say people we don't dey lis ten to us say every day different new thing, new
Exactly.
thing. I should say them ma go want know wetin fit cause this kind. This new one we don't bring come again today.
Yes, especially as he talk and now say disorder different from difficulty.
From difficulty. So now we go call on the expert now, Dr. Bako, make he tell us wetin fit dey cause this kind thing for
Yes.
children and people generally.
People generally.
So my people now, well done. Yeah, as a matter of fact, talking about communication, because Oga Boniface don't explain at least the differences on how the communication they arise from. I don't even be psychological, it can be physical, that's anatomical. Because now I'm talking about that now, I'm going to put them in perspective. Some of
Dr.
them will
Bako?
be acquired.
So you
Waiting
collect
maybe
them.
for road, you collect. If it happen. Then some again it be genetic or congenital. Maybe something as they born you with and it follow come.
Oh, okay.
Okay, now let's talk about the congenital part of the difficulty with communication.
Yes.
Let's talk about the genetic part. We get also anatomical component, just the way Boniface talk about. Okay, it's like person we get cleft lip and palate.
Cleft palate now.
Cleft palate. And those abnormalities they happen with children. Where we say, you see, say them born picking. Some of the palate no they closed, and some of them go get cleft lip self. So they need a few whole air to be able to form words. And even if the palate here they open, because there's a way anatomically, if we they try express ourselves, there's a way wind control they happen inside the mouth for us to be able to at least make words. But when those things they are affected, because the palate, the upper area of our mouth, they open, form during childhood, during when picking them from mama belly. So you see that kind of people will get difficulty with talking. So this one are just anatomical or structural problem where persons get. Okay, you can't get trauma. That one something you acquire for root. You get accident and maybe you can't move your jaw. So you even get air for mouth to be able to talk well. Also, people they born there with natopathy where they don't even get this lower area of the jaw. So to still hold air for mouth now also problem. So you see all of those ones be what if you give them communication problem. Then another common one where they always talk about people who get autism. They get that problem because those ones are neurodevelopmental problem, and hence their development and everything to the level of even meeting up with milestone. They retarded, they backward, or some of them say before they go even achieve, and depending on which level or which spectrum those individuals do, that one also affects communication and even understanding words. Because just like Oga Boniface talk, communication will be just about voice or anything.
No.
Sometimes, like when they always talk about dating, we'll say, you get some kind of gestures or cues so person will give you. If you look to one kind, the man is supposed to tell you, say, what they do, they mess up, make you adjust.
Yes.
It should give you that serious eye.
Look,
You're gonna, but then some of those ones, because that one on its own are communication.
Yes.
And if you normally will get the message well, but for some people, even to understand that one, no problem. So them man a communication gap. Persons where they just okay get stroke. How where the primarily say start from there before I even talk about the stroke. The primary area for our brain where they control speech. Like for majority of us for this world, our dominant hemisphere for our brain, because our brain gets two areas. We join together by one midline area. I know I even call it name because even most of us don't like Ram himself. They call it corpus callosum. Then behind, you get where they can go, they could sit. Now, maybe if somebody gets stroke for this part of your head, now the other opposite side go weak. If you get for this side, the opposite side then go weak because of what happened behind the brain. But the speech area for most of us, where they right-handed. Majority, I can say majority of everybody for this world.
Right.
Now, the speech area, they here.
The left-hand
The left-hand side. They the left hemisphere. And that area now contain where they call the Broca's area and the Wernicke's area.
Yeah, brokers.
The Broca's area now they control the exact muscle activity for speech formation. While the Wernicke's area, all of those information, physiological part for you to be able to assimilate or move information from one point to another. For people who get stroke, don't like we say those ones are an acquired form of communication. Sudden inability to talk for person where they talk na stroke. And you see that the person feel they move all of him body, but because if he gets stroke for the left part of him brain, it's either come down with slurred speech or sudden inability to talk.
No go fit talk.
I can tell Boniface, I say, they get plenty patients like that. I will start link them up so that I mean try to see him.
Speech
And that's
therapy.
what is a very slow process, but then these are things that you make the patient understand, say, man, this thing has so it be. So ordinary stroke, because if you get meningitis, anything where you compress anything inside the brain, meningoencephalitis, that's infectious causes. All of those things we suppress and make person get difficulty with. When a born picking premature. Because those ones, just like we don't be talking before, every other developmental thing never really reach where it's supposed to reach. And where those things supposed to really happen, like in utero, inside the mama womb. So even if mama womb, so some of those things after picking come outside, meeting up to all of these things becomes also a problem. You get head trauma, do accident, hit head. Some people, like of recent, I see one patient for one of the places where the wrong clinic. The same thing happened. He get one better injury like that for in left part of the brain. If you see a mutation and stroke, when I say many repeat the MRI, see the whole, like almost half part of the brain for that place, they black. That's the majority of the cells and exactly around the Wernicke's and Broca's area. Some of them, your sister, if you say they try to talk, they need to understand what you did. So they hear the word, the ear they work correctly. But then they need to fit combine them because even the communication around the Wernicke's area, they even meet up with waiting the words they try from. So they know if it makes sense of them. Some of them will get total aphasia. Some of them are receptive aphasia to understand my problem. Some go hear them, but to make the words Broca's aphasia, they don't go fit talk. And many, when we talk about the aphasia, we get different types, small type. But those ones, they know they are of utmost important. Maybe people they do bukuru, men and go continue for them. Because a big topic for my field. Now, plenty topic. Maybe say every day they read them because some of them they always forget them. They transcortical aphasia. All those
They work out, they don't move.
They just go together like that. So expressive aphasia, all those things, receptive aphasia, and they different type. So all of those things fit be the reason why a person get difficulty with communication, difficulty with understanding, and even generally to even talk on a problem.
Okay, Dr. Bako,
Wow.
thank you so much. You know, as they talk now, on top the learn where they learn, I just they think about people where they join us where we're for this program. Make you no come be say you go they feel say every day would they na so new different conditions will they bring. At the end of the day, what would they try accomplish for on top this podcast and everything? What would they do? Now to increase awareness and to also let on know say help day.
Yes.
So no be say we
Not
go
just
just
fear
tell you, make you begin fear or make you panic or anything, but make you understand, because the first step, if you want to solve problem true, the first step now to understand what your problem be.
Yes, exactly.
Once you understand
100%.
the problem, then you go fit know the different things where you go fit do to take solve that problem or to take help the person where they involved.
Exactly.
So now what will they try achieve on top this podcast now be that we will tell on about the different areas of special needs, tell on say hope day, tell on where on fit go find support for both these individuals where they live with these conditions and their family.
And their families.
At the end of the day, we want create fully inclusive society. Where be say you know go they look say this one different, make her find way to cheat and make we drop, make we go throw away these ones because nothing they feel follow do. The God will create us, send everybody come this world with something. I quoting Dr. Bako they talk say anybody will get brain. You know useless. So now I want to ask this question now for Mrs. Modupe. As parents, when get pikin, we get special needs. How you take experience communication difficulties and how you take manage them for your own space.
Okay. Do well, Oga Sam, Oga Boniface, and Dr. Bako. Now do well for the school that don't carry us go. Yeah, you know the thing is, first of all, as parents, it's good for us to, as I talk before. Anything we would do concerning our family member, whether an parent or whether another family member, we take care of another family member. Make we know the result we would get. Nobody say we will not go assess the result, but we will not just they calculate the result, follow the effort. wey we dey make. Because this journey not be easy journey.
True.
And sometimes na very, very long journey. Especially when this communication disorder come enter. When you be say, pikin no understand wetin you dey talk, you no understand wetin pikin dey talk. Like in my own situation now. My boy now, if he get headache, he no go fit tell me say he get headache. Imagine, pikin will be 18, they go 19. He no go fit tell me say head dey pain me. 3 days ago, or 4 days ago, when he come from school, I just noticed say he dey limp. The way we dey waka, I go say, this boy. It be like say he hit he leg. If not that pikin, he never come down. Plus everybody will go carry her come from school. Now I go to tell say, my leg they pay me, my leg they pay me. And as they enter, you don't they shout, mommy, leg, my leg they pay me. But instead they drag the leg. So after I don't bath and finish, me, I don't even know, I they try to depress different places for the body, make I didn't know where exactly the pain now. When I can't touch your knee, the way they move the leg. I come massage the leg for her. That now because say he dey with the parents. What if nobody there around her?
Yeah.
At that immediate time. So why they talk this one be say, even though us as family, it no dey easy for us with family members like this. Make we not think say na only us they suffer.
Yeah.
They too they suffer.
Yeah.
Imagine the amount of frustration with the inside person. We know if you talk what you want, how you want her, what they feel. You know? If your body no hot now, even
You no go know
sometimes
say
throw
they
up,
sick.
I no go know
So they
say,
sick.
except say if I want just place some on routine, so okay, every 3 months or 6 months, I go to give her malaria medicine because mosquito dey everywhere. You know? So now that one, now we know. What about other situations? Some children have a leg they pain them. Eventually, you can realize it's appendicitis.
We say
Imagine
don't
that
go
kind of
far.
condition.
Yeah.
Imagine that kind of condition. But the thing is, say, as Oga Boniface talk, not be only the problem, solution there. First of all, you have to say how we take they communicate. Sign language they there. First of all, as we talk for this program, for people where they follow us from the beginning, the best medicine for anybody with learning and intellectual disability na early intervention. No wait till the pikin don't big finish before you start anything. The ones where my boy know now, if he use and communicate with me. The ones where you don't know, is still the learning. And me too, they always they think of ways where I go fit it the richer. Which means you go they observe them well. Because not everybody know sign language.
At all.
But we feel devise our own sign language.
Exactly. Now same make
You don't need to go school, go learn now. Because at the end of the day, wait till you get interest, now you go want learn to relate with. If you see, because that be the beginning. If you see the pikin as human being, you go do everything what you want to do to take richer. There are pictures there. Pictures of food when you like. Pictures of fruit when you like. Today now, when you wake up this morning, I carry him, I use the hand to touch him body. Who is this? He mentioned, he make mistake. Then I can tell him his name, Isan. I touch my own. He say, I be Isan. I say, no, Mama. Touch the kitchen staff. Like that. But the thing we say, it must be something where person go they do
You could
all the
repeat
time.
and make it till a master.
Because their own length of to they teach them, it they take time. Person no go tire. Because that one now physical engagement. You hold your hand. If you hold your hand, book, hold your hand, cup, hold your hand, plate, hold your hand, water. If you know everything where they inside that house, where they stay, you don't learn many things now.
Yeah.
And you go don't begin to communicate some things where normally you go cause problem, you go scatter area.
It go tell you.
Now you go show you, or you go tell you.
It go tell you because if he tell you, say, he want this one. If you want to go inside a room now, you go say sleeping time. Then you know say, okay, Oga he won't go inside a room with that. You know? So those if we there outside now, you want peace, you go say, sometimes you go say toilet, sometimes you go say pee. Then you know say, okay, park car, you won't use toilet. So all of those essential important things, eat, all of those things, make you know that. Because as you talk just now, if pikin don't get a way to tell you what you want, he go fight. He go show frustration. So And the thing about this, our family members, be say, if we really put our mind, say we want to help them, many things what they teach us about ourselves, unbelievable. Many things. The place where they carry us go, the kind of things we will call the lane, they sabi on your own. You know, if they're not there around you, no, not get any reason
Nothing won't
to
carry you
just
go that
push
side.
yourself to that level. Because every time they think about them, you they think about them, they try to think about, okay, how you want to manage the situation now, make you reduce. And once you don't solve that problem now, you don't be expert for inside.
Exactly.
You can't be advisor for other people. And this was a human being who they talk so. Not be only your picking get this kind of condition, there plenty. Not be only you want their frustration, they worry. People plenty. Once if you give person one advice, two advice, will work for them. You don't become.
You don't solve
don't
your
become-
consultant.
You don't become consultant. People who sabi make money, they go put change on top of them for their time. Because the river where they swim before they reach there, not be small. So pictures. They talk to them. They look their face. The find out say they know if communicate with, they know if tell you everything within their belly. Not mean say they know they hear. As long as I don't confirm, say you no get hearing problem. They hear, they understand. Sometimes the way they go take behave, go tell you say, this pikin understand what
Which
he
I tell her.
understand something so. Because the truth be say, even though they get weakness, they grow. Whether you like them or not, they
Experience
go grow.
said they
Exactly,
follow.
they experience their own things in their own way. And even the way when you relate with them, they learn from all of those things. Then, if you say you want to do teaching setting for professional level, parents too first to learn from this approach. Two ways where you feel use now, what you would they call now one term, but you feel use them in two ways. We they call them chaining, forward chaining and backward chaining. So. What be forward chaining now? Forward chaining be say you go start the work where you want to do with the pikin, and I go start am from the beginning to the end. But backward chaining be say you go do one. The last one, now then it go for join you.
The last step now.
The last step. Why? Because of this communication problem now, some of our children they lose focus. They know they feel sit down there. Because of frustration matter, where they follow this lack of communication. So they're not that easy to teach like that, but you not go feel leave them. Both for teacher and for house. Maybe you want engage them. You want teach them, okay, how to put a shoe, how to wear his socks and the shoe. You go wear the socks for him. Put the leg for inside the shoe, then you go finish it. For example, you see now no small now you do. Because if you say make him wear socks, make him wear shoe, I no go come out for them. You don't start the process for him now. For example, now socks and shoe, now you want to teach him. Wear socks for him, wear shoe, reach, make small, make it just finish him. After, you wear the socks for him. You go wear the shoe, but you go leave space, pass before for the back, make it finish him. Like that, till you go wear the shoe by himself. Then, the socks, you go come, wear and reach one place, you don't go complete them, make it complete. Because that's a big shoe now. Before you know, you go to wear the shoe and socks by himself.
I understand that forward and backward.
Because you cut them small. Now that one I be the backward own. You know, you cut them small. Now the small one I for start. But the front own, the forward own, be say the pikin, they focus, but they forget. You know, the disorder it affects the ability to remember the steps of the things where you want make you do. So it go start from the beginning, but you not go do all one time. So if not three steps, like they what you want make you do, make you do two first. Once you master that two, you go add the third one. You know? So this one are for teachers, even for house. When you want to teach them how to do things. Then you on top of all of this one, you go print pictures of the things where you want to make them do. Like that shoe now and socks now. If you don't want to talk, because sometimes when you two talk, especially children will get autism. When you two use voice,
they confuse themselves.
if you not gonna use voice again, they not go do anything. They go don't associate only voice with that work. So if you don't want to make voice to enter their body, just print the picture of socks and shoe. When you don't wear the socks, finish for them. Or first time before you start, you go show and socks, shoe. Then okay, you don't wear the socks for them. Then to wear shoe now. You go wear the shoe for him, leave and reach where you want leave him, and you go wear. But you know the two things when they engage with. As they learn how to wear the socks and the shoe, and if they see the socks and the shoe for picture. We dey spend money, we must spend money. Because if you not spend money, you no go fit achieve anything. And we know they spend money for them, pass as we go spend for our other children if we start early. Now, when we not start early, now the problem can't be plenty. And that is why, thank God, this organization, this group of people, they here for now to ask questions, to get support from.
I just want to matter for this matter where she don't bring up. You know, now this particular topic or this particular matter where they talk, make this communication issue very, very important.
Yes.
Because I can't notice from my field of work, see many parents they too focus on speech. My child know they talk or language, they understand or express within I want make he express. But they don't know says both speech and language they find their purpose inside communication.
Yes.
If communication no day, that means no need for speech and language.
Yes.
So I they try anytime when I meet them, I they try make I refocus their attention. Instead of to the focus, say this child must talk something now. This child must speak my language. He must speak English or he must speak Hausa or Yoruba, any of your language. You go focus on to say, make this child, make him get that ability to express in mind. Any means way he express in mind. Just they open. If you use sign language as you talk, if you use picture, in fact for that backward and forward
training,
talk, if you use sequencing picture for sequence,
yes,
just they take pictures, waiting the small acts where you want to
make it achieve.
Use them, they explain them for them, make him set them. I seen they picture this thing, they grab the concept where they present to them. If you they do the activity, he go remember.
You go remember.
As you bring one after the other, they do it. He go remember saying now like this. Now this one first, this one next,
yes,
this one last.
Yes.
They help them well. So you feel use many medium to actually help these children make it be able to express within their mind. Now waiting is supposed to be our focus.
Not to use mouth to take talk.
Not the only mouth where we use to communicate.
Kai. Thank you so much. You know, say as a day, me server they soak all this inside. Everything on the talk. Everything on the discuss this. We get one question, but before we address that question, you know, say these communication disorders, we don't really dwell heavily on the ones where maybe Pikin no fi talk. You know if you use words, you know if you use speech and language like waiting Oga Boniface they talk. But the conditions where they under this umbrella, they plenty. You know, say for instance, they say person they stammer, stuttering, see the speech therapist here. So plenty conditions they, and some years back when I begin the practice special education. Now I can learn about another one, selective mutism.
Selective mutism.
Say Pikin sabi talk.
But you know why you talk?
He go just lock up based on environment or person where they around.
Yes.
Parents go come and say, Kai, this my Pikin na very calm, he dey very coordinated, you know, they do anyhow. Teacher go say, this one we do this in one place, in maths.
You want to glue.
Or sometimes it go be the other way around.
Yes.
He say, my Pikin, they play where they jump everywhere, he get plenty friends for us. But when he go school, now I can learn say, now also part of like waiting. If you follow put them under communication disorders,
yes,
this selective mutism now.
Based on recent researches, what they don't do, they can't find out say this selective mutism is more of psychological. What do you mean? Be say
na for mind.
Mind matter. No be say the person get problem with the organs.
Where they
use
talk
for speech.
No.
Or no be say you get problem with the brain where they process
the information.
Now just maybe you get traumatic experience, or maybe the child you get how in they feel, you get everything they think about the environment where he did, about the person where you don't select.
Say,
Kai, Boniface. You know,
that's why I select to mute.
you know the funny
I like
thing.
that one.
As you just be talking now I remember one of my friends that
You
year.
really select to mute am.
When you want crack joke, if you don't say,
wow.
Kai, my kidney, they pain me. You go touch me, I say, my kidney. So as they talk mine, they be like, you know, say for this kind of side, they say, Kai, you get mine, you be like, say, my so now it's just
So
from my head.
the person just select.
Yeah, you don't offer me, you offer.
You offer. You off the person, off the environment.
Make we
Okay,
take
now.
this question. This person to say he want know more about tongue cutting and speech. And say they cut tongue, whether how the thing they take relate with speech.
Who the
So
person tongue?
make Dr. Bako.
Never cut tongue for my life. Now they be doctor. Then they see all.
As a matter of fact, well, tongue cutting may be normal procedure. It will just be accidental thing. But most times, some of the things that people they do in which even for medical practice today, they don't stop and this uvulectomy. Where you feel like that time they will say, swell up.
That belu.
Now only those are even now already they against that one because ordinarily na inflammation and most times even an infection will cause the inflammation and beat analgesic, multivitamin, maybe vitamin C and antibiotic it will come down by itself. So those ones say even if until maybe there is a complication, nobody does that anymore. Primary tongue cutting, the primary organ where they fit maneuver speech, na be tongue, outside the vocal cord. Because the vocal cord they manipulate the voice. Because there are plenty areas, there's plenty cartilages where they are around that area. And the primary supply, they come from the 12th cranial nerve. They call it hypoglossal. The hypoglossal nerve, the nerve we come from brain, can supply the area of the tongue. And all of the tongue activity, how do they turn, how do they feed, control, when you go attach the palate, when you go attach the other side, just to create that what to wind air. To maneuver air within the mouth. So that there is speech goes. So now if then cut your tongue, primarily, those ones they cut in between, then fit still manipulate. You know, say some people for fashion sake.
You go put ring or put something.
Go put ring. Cut her into two.
Like snake.
So those ones they fit still manipulate. But if now this kind of way that transverse cutting, where we say this one come out, you know go fit up. Unless maybe they put one speech, something around your one tracheostomy, so you put something around, it will hard to make you feel great word because the tongue they play very important role during muscle activity for speech to form. Now make them cut your tongue, you cannot talk.
I beg.
Cute.
Man, I'm not cut person
tongue,
we don't shut up. I beg.
What they do?
They just cut that. Even if you do speech and language,
I don't understand. Why you go carry your tongue down, make that they cut down?
Another question did the group self. This person say Pam the quiz. He say well done, great people for this correct and life-saving program. I beg. Okay. It's I beg. Wetin dey make person eye or brain no dey connect with colors? But before him see colors, the person if the person see color, the person dey get joy. Now the first, he has two questions. Make I talk again. Wetin dey make person eye or brain no dey connect with colors?
Okay.
Maybe then when they see colors they get joy everywhere.
Yes.
Then the second question is if person get paralysis for either right or left side of him body, wetin be the consequences?
This one is my question.
Dr. Bako. All power belongs to you, sir.
So talking about that colors, well, yes. So that most times when you get some kind neurodegenerative problem, if it come happen directly, most times in the brain, then few times directly on the eye. Like if you get inflammation of the eye, like you get one sickness what they call optic neuritis. You get optic neuritis, sometimes even to appreciate color, they become problem. Whenever there is vitamin E deficiency, either congenital or you acquire them for road, You see, say some people they get night or color blindness. Then if you appreciate color, so some of them now due to some vitamin deficiency. Even some people will get stroke. Sometimes, depending on which area of the brain they touched, and especially towards the exceeding nerve from that area to the optic nerve where they supply our eye, then if it gets problem with understanding color. So those ones, depending on which if they cause that color problem, then feel manage them as such. But mostly it's either directly on the eye or on the brain. On the eye, maybe inflammation, which one of the commonest thing where they cause maybe optic neuritis. While on the brain, all those neurodegenerative problem, all those dementia like Alzheimer's disease, Parkinson's disease, as they go further, or some of those neurodevelopmental problems, fit also give you that one, or vitamin deficiency, or with vitamin A is one of the commonest. So when person gets stroke, how the question be that second question?
He say if person get paralysis for either right or left side of him body, how you want take affect the person?
Yeah, no. As a matter of fact, normally whenever you get stroke don't happen. It's either maybe the stroke will happen whether a blood vessel for inside your brain burst or blood vessel for inside your brain block. Either due to rupture of blood vessel or maybe blockage of blood vessel inside person brain. And the major thing, just like we talk, if there's anything the brain understand, it's either glucose or oxygen. And anything pass down are the two primary things with that, because the energy activity of the brain, now glucose is always born. We convert glucose to ATP, ADP, and the rest. Those ones now for people they do bukuru. So when those things they blocks or get them at the way it's supposed to be, then they manifest as this weakness. And why the weakness they come? Because as that blockage happen, oxygen will go, glucose will go. So long the cells don't see these two things, they will start die. For inside your brain, you're alive, but those cells will start die. So those dying of those cells, depending on which area of the brain that thing they affect, then go manifest for our body. Just like we say, the brain get two hemispheres. If you happen for the right side, you see that the left side of your body go weak. If you happen on the left side, you see say the right side of the body go weak with associated difficulty with talking. Because majority of us are dominant area, speech area, they on the left. So that's why it will manifest. So after that one, then what next? Stroke don't happen. Yes, it gets some things will fit happen subsequently, which is rehabilitation. Why you could try prevent any complication will happen, which can be acute or chronic. You try prevent all of those complications. Then you try to rehabilitate the patient. Rehabilitation also involve physiotherapy. It can be speech therapy because most of them they come with aphasia or difficulty with talking, or it can be physical therapy where because of inability to move certain parts of the body. Because if they don't do those physiotherapy, some of them if you get contracture, you see person hand don't fold inside, the leg madam, you say they waka, they call a hemiplegic gait. They say the person movement no they normal. So they don't get really better balance. So rehabilitation and physiotherapy, that the next phase after most of the stroke. While you still push the person through the physiotherapy to see in they try to do those things, the brain gets what ability what they call plasticity. Neuroplasticity should be said because of that physiotherapy, the body will just still see regain back a function. Then it will move function from that very area we don't die to areas where see they functional. So they go fit carry on with those activities. And if you carry on with those activities, that may you see some people despite the stroke, despite before they need a few worker, subsequently see them say they worker. Because I can remember there's a patient we would discharge before for hospital. We discharge them on wheelchair. Then if they come follow up for wheelchair, I think after 1 year, 3 months, they come follow up for wheelchair. Subsequently, you can't start use stick they carry come. Subsequently, I see him recently for clinic. Only him come clinic. With both leg. I know you say the leg they twist. You work up not in the test saying get stroke. Before we be saying now wheelchair in the call clinic, we don't go believe. So now the kind of ability to the brain feed do be that. So now some things where if you don't get this stroke, sometimes for some people are really very lucky. They'll get all of their function. But for some people, again, because even if physiotherapy may be easy thing, even the speech therapy may be easy thing. Because in as much as some people go just 1 minute and get them as magic,
no.
It's very hard. Maybe like muscle injury, if they cut you today, before 1 week you don't close. Brain, if you close, that scar won't carry form for closure, so that's kind of problem for you again. So that one thing with the brain. So mostly now, so most of the outcomes they come.
Okay. Dr. Bako don't over answer the question. So I can't be happy for who asked the question. I was supposed to don't answer that one.
Our check they come. Now we dey call our invoice.
So now make we connect them again. We wait till they discuss today communication disorders. And you know say we go need find way where we go fit take bribe whoever they control time. You understand? Because time don't go. So before we run leave, before we try wrap them up, make we give these our listeners something to take hold on to. When you meet person when get communication disorder, or if you know person or you know family when get pikin, how you want take support them? So all of us for here, we get our own area where we take where our leg takes strong for ground. For instance, me, first things first, I be special educator before I can be autism specialist. So I go fee beg teachers make a shook mouth for this one. So you meet speaking as teacher inside your class when get communication disorder. I like what Oga Boniface talk. Communication no be only to use mouth to talk. Try use other modalities, other techniques, other styles to take communicate, to take reach that picking. I learned to speak sign language. You don't do 2 days. You don't taste more. But now if I meet Peking, we get delayed speech or delayed communication. Even I don't even need reason and plenty times. I go begin gesture. In addition to the talk where they talk. Yes. So I don't go just talk with my hands for sight. I go talk there, they express her. And most times you go begin see the person they smile as you go no see they understand what they talk. And when he want sometimes if they but with the gestures you said communication don't take place. Don't take place. You they teach them something. Yeah. When I use gesture, it go make an easier make the what they teach fit stick. You know, say for this our field, they really talk about multisensory teaching. Multisensory say they try engage more senses. So the picking they hear, you they talking they hear you. You they show them pictures. You they show them the real objects. I want they teach picking 3. Not only picture or you draw for board. Wait, 3 is there everywhere outside. Carry and make you go see the real thing. In short, that one go it go stick like this. You know, go even need do revision. May if you understand it, you don't teach them. So, as teacher, you go need be patient. Yes. Use different strategies to take assess the picking. Yes. And if na oral quiz and this picking, you know say communication na wahala, make it writer na. Make it writer. And if you write and make you see say everything join. The picking don't do it. Then you know say another thing where they follow affect people when they different. Now the way other people they view them. If they come know say then they too different from their peers, and of course they go no, cause then they grow. They grow. They go no. It go come begin they affect their self-esteem. So as teacher, you go need educate all the other children when they that environment. Yes. Say this your classmate too. They different, but you know they less.
Not the less, exactly.
You know they less. That's so right. This now how we would take communicate with them. This now how we would take include them. This now how we would take help them. Once the self-esteem don't day up, even the picking go put extra effort because he go feel at home. He go want to do everything to please, to belong. And the people when they try belong with, they follow drum inside. You understand? So no be saying they push against people where they push back. So now the few things what I feel suggest for educators. I should say the other erudite colleagues go get waiting to add.
Primarily, I think Oga Boniface don't complete everything, especially when it comes to I saw Oga Boniface, Oga Sam. Maybe Oga Sam and Mr. Sam. Like Boniface be Oga. Mr. Sam and Oga. At least we don't try cover for most of what they try to talk about. Because really the communication part, just like you talk, that multi-modality. Yes. That different things. Just like when they say, just like when they make an example with all those non-verbal cues and everything, because them serve the modality of communication on their own. Yes. So all of those things are things we're supposed to employ, even as educators, even as parents, even as who will be safe. We just got to employ other modalities, not just say the book format or the they always talk for medical practice say They say this is the guideline. Guideline are guideline. When you see the patient, you feel improvise on how to help that person instantly. So let's apply that one anytime we take care of all of this kind of things.
Okay, thank you.
Dr. Bako, you do well. Yeah.
Okay, just to add on top waiting we done already, because waiting we done now full diet. Full diet we don't present. But just to add, you see, once they talk about inclusion,
Exactly.
you go just keep on for your mind, say you get accommodations, you get something where I need to set aside so that I will properly include this child for my environment.
Yes.
That one make you just settle for your mind.
Yes.
Yeah, make you, in fact, as you dey plan for classroom management, make you put that one to join, because you need them. Now you get so many things where you fit try, like how Oga Sam talk, or Mr. Sam. You can use Mr. Sam. How you talk. You see, if you come meet a child, you meet pikin wey dey for class, we get challenge with communication. You get other means of communication where you fit use, where you fit employ. In fact, you fit even make they're very, very fun and engaging, where you go make the whole class, make they learn small sign language.
Yes.
As they talk to the child, you know, with multiple engagement, the child too, you go dey help him to speak. You go dey help him to engage generally with learning generally.
Yes.
So you as a teacher, now you will get we dey in charge of that class. We go come set all these modalities in place. We fit use AAC devices. We fit use even PECs, yes, augmented devices communication. You fit use PECs, picture exchange communication system. Where we say you dey use picture, you go allow the child or teach the child how you go use picture dey communicate.
Get with you.
So you get many modalities where you fit set.
Kai, Oga Boniface, you finish work. Mrs. Modupe, make you follow Chukma. Dr. Bako
Don't finish
give us your own 10 cents. Make we hear from you before we carry this ship go port.
My people, una do well. Una thank you, say una don't stay with us till this time. And una know say for every pikin, now their parents now be their first teacher. And their parents be their most important teacher. And teacher go teach pikin how to write 1, 2, 3, ABCD, but how to live life. Now parents go start that one, and our parents hand na till papa and mama go where God wants me them go. Because of that, as parents we don't get excuse not to find how we want to take care of this gifts where God give us, because all these our children they be gift too. Why they be gift? They be gift because they push us. They push us to places where we not feel say we feel rich. They push us to learn things where we feel say we will not think say we go ever feel learn. You want pikin, you want a teacher how to talk say you want eat. The food where you want teacher, call the name of the food to her.
Rice.
Before you show her rice 20 times in a day, you don't know her be that. Give yourself 3 days. Pick 3 things for house. If not rice, if not spoon, if not plate. May we start from the food. You show her spoon, you show her plate, you show her rice. Not be together at the same time. You show her rice 5 times, you give space. Show her plate 5 times, you give space. Show her spoon 5 times, you give space. You do that for straight 3 days. Oga Boniface, Oga Sam, you not go stay the pikin head.
Work don't finish.
So the pikin won't eat now, he go know say na plate they say they eat. Anyway, wait for see plate, he go carry the plate. Now you want show am clean plate, dirty plate. Make one plate dirty, make one plate clean. Show am the dirty plate first, show am the clean plate after. You don't teach am be that. You no go use dirty plate, they eat because you know say stay in day here, you go see am. So we be our biggest support for our children. And those of us we get opportunity to take go school, may we learn wetin dey do our children. We for fit help them. These days, internet dey there. We dey buy data. They watch YouTube. Inside that YouTube, how we go take help our pikin?
You did there.
He dey there. So we not get excuse.
At all.
He dey there. You don't know how finish. Ask your pikin where you dey pay school fees for. Where they go school. Engage the siblings who not get this condition. Or na family issue. If a pastor tell us, say, see what I saw, ask your friend. If you don't understand that, ask people outside. Make it be family work. God go make it easy for us.
Amen. Oh,
Amen.
thank you.
Judge look or understand and talk to send us maybe message.
Send us message. Thank you very much. I got Boniface.
Correct. Sharp. You get one question we drop. I no want laugh too much, but make Dr. Bako just jump on top and sharp. Make him say we don't satisfy this person who ask the question.
Before we go.
Yeah, because the person has of stress and stroke and certain type of stroke. Yes.
They be brother and sister.
Yeah, then they're together. Because anything if lead you to stress, we predispose you to release of stress hormones, subsequently to stress hormones. Again, most of them are steroids in the body, catabolize and waiting to come out later and as steroids again. And one of those steroids now more like cholesterol, and they go block most of our blood vessels, push us towards coming down with high BP. So you see the chain reaction are very long processes, but then they things where they very much possible. Whenever you push yourself automatically, it's just like playing football. You play ball physically, you see your BP transiently go day high. When they down, you stress yourself transiently go day high. And if all of those stress where you put yourself through, they be the one where they burn. Those like waiting where they get from people they play ball, because those ones they burn unnecessary energy. But person just they push yourself under stress and then they ambulate, just sit down for one side.
For one side.
Does it say the thing will become more than waiting the person bargain for, and subsequently this BP fee set. And so long without stress, BP fee calm down, and the BP day high, if you get stroke, then other people if you just get stroke on their own. So stroke they very possible for people who get stress. They very much possible. So that to just try to more get fair balance for our life. When you need to rest, you're supposed to rest. Some of these things, if you touch human being, go tell some man in they go hustle. You get the way you go hustle, that hustle self, you can't carry that money you hustle, go they treat yourself. So this say it don't make sense. So more find fair balance, rest, even as we continue the hustle.
Even inside family, make you try to avoid stress. Because I see that undertone for the person in question. So our people, we want to thank on us, especially say on a don't deal with us, can reach the end of our conversation for today, and we don't feel wait to see on our next weekend. Good news. Next weekend, the last weekend for this month.
Question and answer.
And I know as it be now question and answer all through. So everything we don't learn this month, everything we don't hear, all the questions where you don't get, where if you say, Kai, if I ask this question now, if you not get time to answer. When I write them down, we write them down. That next week, we won't get on a question from start to finish. When they bring any topic, we won't sit down. Everybody go full ground. Once you don't attempt every question we want to bring on. Once again, on a well done. No, thank you. My name, make I know you still Oga Boniface. Make I know still, I still remain. No, my name na Ini Sam, aka Mr. Sam. All right.
My name is Dr. Bako, so now well done, my people.
My name is Mrs. Modupe, Afiz, Ogun. I do well.
Okay, I still remember.
Correct. All right. All right, my people. Till next week. We'll go see you next week.
Bye bye.
Bye bye.